Hey, you all. So I know many of you have already heard about vitamin D3 and a lot of its benefits, like improving hormonal health, our brain function, our heart health, regulation of our blood sugar, which is important for those of you who are concerned about diabetes or prediabetes. Make sure you're taking your vitamin D. Also, it helps with decreasing depression. And it also helps with many other functions in the body, like the immune system and strengthen our bones, which are the ones that we heard or hear a lot about. But it has a huge impact on our body. Our body needs it. But I wanted to give you these quick tips when you are going to supplement with it, okay? So make sure that when you do get vitamin D, by the way, one of the best ways to get vitamin D is, of course, by being outdoors. But because we're not outdoors enough, and also when you're outdoors and you're going to get the benefit of the vitamin D, you do need to have on, something that has a lot of your flesh out. So your body can absorb that vitamin D. But we spend a lot of time indoors. We have a lot of toxic substances and things that are coming at us all day long in our food and outside of us. And so our body really needs, or we really need to be able to support our body in any way that we can to help it to fight against these things and to, just keep ourselves healthy. So when you're getting your vitamin D3, make sure that you're getting at least 5,000 IUs, a supplement that has at least 5,000 IUs, or they have some that have 1,000, but it's probably easier to get the 5,000. But in addition to that, make sure that you take it with the vitamin K2. And the vitamin K2, it helps to get the calcium, send the calcium where it needs to go in your body, out of soft tissue and towards the into the skeletal system. So make sure that you're taking it with the K2. And like I said, if you get it in 5,000 IUs, many times they'll have the vitamin K2 in the proper ratios in the same tablet. Another thing you want to look out for is turning that label around, like I always say about anything that's packaged, and read the ingredient list, okay? Not in nutrition, not anything. I'm speaking of the list of ingredients. And look for seed oils. Sometimes they'll put soybean oil or some other type of toxic oil in it because it's technically in the category of an oil, but it's counterproductive to what vitamin D3 is trying to do. But they'll put it in there. Many of these companies that are owned by huge food companies, they'll also have a supplement company. You'll probably find these supplements in like drugstores, Walgreens and CVS and all of those places. So make sure that the one that you get does not have any seed oils in it, because that's counterproductive. The vitamin D3 is reducing inflammation and the seed oils are trying to work in another direction. So make sure that you get one that doesn't have these seed oils in it. Some of them might have olive oil, which is fine, or coconut oil, because the absorption is better when it's taken with a fat. So you can take it with a fat, like a good organic grass-fed beef or some pasture-raised chicken, of course with the skin on it. You want that fat if you're going to take it with the vitamin D. Also, you can take it with a tablespoon of olive oil, organic of course, or you can take it with some coconut oil, unrefined coconut, organic coconut oil, okay? So just make sure of those things. Get it in the ratios of 5,000 IUs at least, and then also take it with the vitamin K2. Flip that bottle around and check the label to make sure there's no unnecessary seed oils or any other things. They add other harmful ingredients in there as well. And also just make sure that when you're taking it, that you're taking it with fat. Okay? All right. I'll talk to you all later. You have a good day.